HattiesburgSB.com. And today we get to meet someone cool, someone who took kind of a pivot in her professional direction. She is a nurse by trade, but I guess she's also a tattoo artist by trade. Joining us today is Heather Darby from Hattiesburg to share more. Hey, Heather.
Hey, Rebecca. How are you?
I think this is cool. I would say you're a nurse by night and a tattoo artist by day, but really, no, you're kind of both, right? At the same time.
Yes, I am. I'm kind of both.
Well, let's start back with your nursing days because it led into your current career as helping women, particularly during sensitive times after breast cancer or maybe just trying to, make themselves feel better. What led you or your interest into where you're at now with your profession?
You know, I get asked that all the time, and it's really hard to say. I was kind of in a place where I had been a full-time nurse for a really long time, and then I had small kids, and, it was a time where I could not have to be full-time, and so I had an interest in medical tattooing, and I love to draw, and so I'm kind of an artist in my own way, and so this was a little career path that I could be a nurse and an artist and help others in doing that. So I got interested in medical tattooing and started, kind of following that path and got a little bit of training and then lots and lots of training. And so it went from being something I could do a day or two a week to something that I could do every single day. I've gotten so busy that I can be in my studio, every day. So I'm really, really thankful for that.
And Heather, this is a really special niche, like your medical tattooing. And I'm going to ask you to define that when someone's listening. What does that mean? You are bridging the gap or providing a service that there is a lot of women who've maybe walked the same journey of breast cancer or other medical issues that you can help sort of bring them back to feeling like themselves or just sort of give them a little bit of hope or healing. And so how do you define medical tattooing? How is it different, should I say that, than maybe traditional tattoos?
Well, I would say the setting for one. If I was in that situation myself, I personally would not want to go to a traditional tattoo parlor per se. I would feel more comfortable myself if I was going to someone that I knew had been a nurse for 20 years, like myself, in a very private, comfortable setting. And so that's what I offer. I've been a patient care provider for so long that flows into that. And so it really, really makes my patients feel so much more comfortable, and it eases them to be able to come to someone that is used to taking care of people.
I love that you call them patients and not necessarily clients or customers, right? Because you really are providing kind of a medical service. So who are your patients? What type of individuals find themselves coming to your studio?
Well, when it comes to my 3D areola work, which is what I'm most proud of, it is those that have had breast cancer. They have gone through multiple surgeries. They have gone through reconstruction, and they're at the end of their journey. I'm kind of that cherry on top. And so you want that to be very, perfect, because you've been through all of these steps in that journey, and that very last step is what I do, and it has to be perfect. So I actually tattoo the areola back on the breast, and to the naked eye, you can't tell the difference. It's absolutely perfect, and it looks just like a normal areola would.
And not that your patients are walking around town naked and sort of showing off, their tattoos.
Right.
Not all tattoos should be shown, right? But what does it mean to them personally, just as, a woman, to sort of be able to look in the mirror or take a shower or be intimate with their partner and just feel whole?
Most of them tell me they just want to feel normal again. And a lot of them will say it's not important to me. It wasn't important to me, and I never thought it would be. But now, when I get out of the shower or when I look in the mirror, now I'm not reminded. I think not having them there is also a reminder of what they've been through. And so this, provides them with that, I don't see anything anymore. It's just normal and looks exactly like the real thing.
And I think this is an area so interesting to me where you can take multiple talents and sort of use it in a different way. There may be, I'm sure there's a lot of your patients who come through your studio there, Heather, that probably have no other tattoos on their body, would have never,
That's right.
and that this is not just pros or cons or whatever. It's your body. Do what you want in terms of decorating it. But there's a lot that would say, oh, I would never, necessarily choose to get a traditional tattoo. But when you think of it in terms of medical purposes or sort of bridging that gap, it's a different conversation. What other sort of medical tattoos are there that you provide?
Scars, for one, C-section scars, facelift scars, or it could have been a scar from an accident. I do some of those things. I also do some other things like skincare, microneedling. It also helps with scarring, and stretch marks and hyperpigmented skin or discolorations. So all of that kind of falls into what I do as well. I also do cosmetic things. I kind of just branched out from the areola work. So I do also do all the eyeliner and the eyebrows and lips, but what I'm most proud of is the 3D areola work and helping those ladies after they've finished their journey with, all their breast cancer, post-mastectomy and reconstruction.
I feel like there's probably a lot who just don't know that this service is available, or they think it's unattainable, or it's just not here in Mississippi.
Right.
So are you the only one in Mississippi doing it, or in the Pine Belt, or is there a way for those listening to Good Things all over the state to get this service if they choose?
I'm the only one that I know of that is a nurse that was trained under the lady that I was trained under. I'm sorry. But I know that there are others that do, I'd say, dabble in it. I don't know that there is anyone that maybe takes it as serious as I do. Kind of, almost obsessed with it. It's at some point where I practice so much because I want it to be so perfect. So I don't think that there's anyone that does it to the point that I do. But I know that there are some other people available in Mississippi that would do it.
How long would it take for you to do the areola for someone? Is it a day visit? Is it multiple visits?
No, it's complete the day that you come. So it takes me about an hour for each side. So you're complete whenever you leave. But I do want to see my patient back in about 6 weeks just so I can look at it and see if I need to do any, little minor details. But you'd be complete with one session.
I feel like that would be worthy of a road trip to Hattiesburg if met the qualifications.
Absolutely.
And it would mean that much to them. So I actually know that we've connected a listener before. I don't know if they're listening today, but talked about how it was a husband who actually gave your information to his wife, and you completed something she didn't realize she needed. So, for those that are like, oh, what does this matter? For others, this is a really big deal. And so it's a huge boost in overall self-confidence and well-being. So how do they get in touch with you, Heather? I think what you offer is really cool.
Yeah, so I have a Facebook page. I cannot post pictures on Facebook of
Imagine
areolas,
that.
Even though it is a tattoo, I see it as a piece of art, but Facebook does not see it that way. You can, however, look me up as Pigments Permanent Cosmetics, just like the ink pigments. So I'm on Facebook. I'm on Instagram. I can post on Instagram pictures, so you can see lots and lots of pictures of my work there. I also have a website, and it's just pigmentspermanentcosmetics.com. You can find my number there, pictures, all of that, all over social media.
Well, Heather, I appreciate what you're doing. I love that you just took your interest and you found a way to really give back to a community that deserves it and needs it. So kudos to you, and I hope you have a good day.
You too. Thank you so much.
All righty. I'll stick with this. We've got more for you coming up next.